So one of the questions I get fairly often is there any supplements I can take, to ease the symptoms associated with PMS? And the answer is yes. So let's sort that out so you know what to do. And this is an important topic because over 90% of women report having symptoms associated with PMS, and 40% report that it interferes with their daily life. Now, just some basics to make sure that we're all on the same page. PMS is a combination of symptoms that appear before the menstrual cycle, and it can include things like headaches and bloating, cramping, and sometimes mood changes, even depression, but also back pain or fatigue and cravings. Those are some of the most common symptoms. The conventional treatments are things like Midol, which might provide temporary relief, but also come with their own set of side effects, which can be pretty harsh. And the most common side effects are the same as the symptoms that you're trying to get rid of, like stomach irritation or swelling or trouble sleeping. So when you end up with the side effects from the drug, you probably don't even realize that it's actually coming from the drug because you'll assume that it's just the symptoms from the PMS. Now, since low vitamin and mineral levels are, one of the causes of PMS, let's look at how replenishing some simple key nutrients will help to diminish PMS and support your overall body health. The first is vitamin B6. Besides helping your body to use hormones and produce energy and utilize oxygen, it also helps to relieve pain naturally, by influencing your brain's neurotransmitters. B6 also positively influences hormones that control mood and energy. Hormones like estrogen and serotonin and GABA. GABA is a specific chemical messenger that helps suppress anxiety and improve sleep. Research has shown that patients taking B6 supplements have less pain and better mood and more energy. So here are some foods that pack, a lot of B6. Turkey breast, grass-fed beef. There's the avocado again. It's actually on both of our lists we're going to cover today. Pistachio and sesame and sunflower seeds. All right. So the next nutrient to help lessen the symptoms of PMS is magnesium. Levels of magnesium naturally drop right before the menstrual cycle, right? And you now combine that with the fact that about 80% of the population is chronically deficient in magnesium, and then throw in some stress, which also depletes magnesium, and you're almost sure to be depleted. If not all the time, then at least during your menstrual cycle. So magnesium might be best known for its role in relaxing muscles and getting rid of cramping. But it also helps your body metabolize estrogen, and that's a good thing because in excess, too much estrogen can cause PMS. In fact, magnesium eases the majority of PMS symptoms, especially poor mood, headaches, and cravings. A study on the impact of B6 and magnesium supplementation on PMS actually showed that the study participants that took both reduced PMS more effectively than a person that took just one or the other. Now, the improvement in the study was observed in women between the ages of 15 and 45. The dosages that they took were 250 milligrams of magnesium and 40 milligrams of vitamin B6. Now, one of my favorite magnesium products is called Natural Calm, and you can get that at bodymanual.com. But whether you use my product or another quality magnesium supplement, either way, just make sure that you're not magnesium or B6 deficient. All right, so give those two nutrients a try, and I'll see you in my next video. And don't forget to subscribe, and I'll send you my latest videos.